So I was a grinder for as far back as I can remember, and as a result of that, I had broken several of my teeth over the years, to the point that, including I had actually ground off most of the enamel off of my lower teeth. So I reached a point about a year or two ago where I decided, rather than have a few of my restorations replaced, then knowing a couple years later I may need to have more replaced, and including as well as taking in consideration what my lowers look like, I decided to have a full mouth restoration from a dentist that I knew that had specialized training in cosmetic dentistry. So I went to this dentist, and the dentist was the first person to share with me that I probably did have TMJ, and what was causing me to grind and my tooth breakage was that my bite was very closed and we needed to open up my bite. So we did that, and we did a full upper and lower veneers in my mouth, and a result of that was actually more pain than I had had previously. Previously I did not have a lot of pain. I had the grinding, and as I mentioned, the result was the teeth breaking and having to have crowns. But when I did get my full mouth restoration, I started having severe TMJ for the first time, and the grinding did not stop. So that's how I found Dr. Konig.
And after Dr. Konig changed your bite and aesthetics, how did this change the way you felt and the way you felt about your smile and even your facial features?
So what Dr. Konig did that was different was, I did not know at the time, after I'd invested lots of money, time, effort in having the first restoration done, is that I didn't realize that changing your bite was more than just guessing as to where your teeth needed to go, that there was technology and training that some dentists actually have, such as Dr. Konig, that others do not. So what Dr. Konig did is through neuromuscular dentistry and his artistic talents, he was able to get my bite exactly where it needed to be. And additionally, the restorations that he provided were much more lifelike. I think they're much more, much less, I don't want to use the word fake, but that's really the only way to say it. They're much more realistic. And therefore, I feel like I have the best teeth that anyone could ever have.
Well, your smile certainly is beautiful, and I'm so glad that you're more comfortable than you were when you first arrived to our office. Is there anything else that you'd like to share about your experience or how you were treated in the office here?
Sure. I would say that my case and my mouth, I'm probably a bit more sensitive than many patients. And as a result of that, I've had several adjustments, including one today, and I think that the staff has been more than accommodating to get me in and to make sure that everything is perfect, and continuing to work with me to get there as much and as often as I need it. So I'm very appreciative of that.
Well, we will always be here to help you. Thank you so much, Robin, for sharing your story. We are grateful that we had the opportunity to help you.
You're
Thank you.
welcome. Thank you.